It is my pleasure to introduce Dr. Sharon Bergquist. She is a friend and colleague whom I first met when I joined Emory over 10 years ago. She is an assistant professor of medicine in the Division of Internal Medicine and Geriatrics. She joined the internal medicine faculty in 2000 and has been very productive in her division since then. She is recognized as a Rawlings Senior Distinguished Clinician and a Master Clinician. She received her her medical degree and completed internal medicine residency at Harvard. She is the medical director of Emory's Executive Health Program and leads the research program at the Paul W. Seavey Comprehensive Internal Medicine Clinic. She also founded and directs the Emory Lifestyle Medicine and Wellness Program. This morning, she'll be talking to us about mental health wellness in the midst of a global pandemic, the impact of COVID-19 on clinical providers and patients.
Good morning. I'm Dr. Sharon Bergquist, an associate professor of medicine at Emory School of Medicine. And this morning, I'm going to be talking about mental health wellness in the midst of a global pandemic. As healthcare workers, we've encountered the stressors from COVID-19 from different perspectives. We've had different pieces of the picture of its impact on mental well-being. We've seen its effect on our patients, our colleagues, and ourselves. Some of us have faced the stressors of inpatient acute care and others the outpatient chronic stressors. And depending on our specialty, we've had a different call to duty. For our patients and ourselves, I think we can safely say that in some way our lives have changed in positive as well as negative ways. I'm an internal medicine physician, so from my perspective, I've seen the impact of COVID-19 from a whole person perspective, how mental health affects physical health and vice versa. The focus of my clinical work and research is on well-being, and from my viewpoint, COVID-19 has put well-being, and particularly mental well-being, to the forefront. I have no disclosures other than being very grateful and delighted to speak with you on this topic today. I want to start by talking about our collective experience, ours and our patients, to sync us on where we've been and where we're now. Then I want to drill down on explaining what we mean when we use the term mental well-being. What are we trying to achieve? And then I want to discuss how we can emerge stronger. Spoiler alert, I believe with regards to mental well-being and health in general, we can use this point in time as a unique opportunity to do things differently and encourage the same for our patients. We can raise ourselves up and bring our patients with us. Let's start by taking inventory of where we are and where we've been. The challenges from the pandemic have come in stages. If we go back to a year and a half ago, there were stressors inherent to COVID-19. We were facing uncertain prognoses. This was a novel virus, much of what we didn't know about. We didn't understand the risks, the complications, proper treatment. We were facing resource shortages, both in testing, as well as treatment with PPE, with ICU beds and ventilators. There were sharp disruptions in how we lived our lives. It completely upended life as we knew it. We had to create new daily flows, new workflows. There were global effects, supply chain disruptions. And then came a wave of secondary stress. These are prolonged stressors from the duration of the pandemic as we began to realize this wasn't going away quickly. Social distancing, quarantining, and staying at home orders led to social isolation, especially for those who live alone, and loss of human interaction is so vital to our being. There are financial losses, unemployment, certain industries were hit incredibly hard. There were business closures for a lot of people who were working from home. There was a blurring of work life. Many had to adapt not only to working from home, but with their kids being at home as well, as a lot of schools switched to remote learning. We began facing Zoom fatigue, which is a real phenomenon based on the extra work our minds have to do for asynchronous communication and the difference in biochemistry of virtual versus in-person interaction. And currently, a lot of people, especially our patients, are facing re-entry anxiety. And why? Because the crux of anxiety is uncertainty. After a year and a half of being home and getting comfortable in a new routine, it's time to shuffle the cards again. And we're once again faced with uncertainty. How will this new work-life balance look like? How will people balance it with their current home obligations? Will it be safe to be back in the office? For those who travel for work, will it be safe to resume travel? But before I brush off 2020, I want to pause to note that so much of the mental toll has focused on the negative aspects of the pandemic, but every cloud has a silver lining. With appending our lives, we've broken norms. We've learned to do things differently. Maybe we don't need to travel as much for work. In healthcare, we've learned to do virtual visits. Other work functions can also be done remotely. Some have taken this as a time to reboot. Some of my patients have developed new eating habits, new exercise routines, and have spent more time with family. And the pandemic, like all life transitions, is really an opportunity for making meaning. I know many of my patients and coworkers are reflecting on what means most to them, the good things from the pandemic that they want to bring forward with them. Some don't want to go back to the craziness of overscheduling kid activities, overcommitting to projects, and people have had a shift in their priorities and how their time is spent. Collectively, we're reflecting on what role work has in our lives and our lives have in work. How we've responded has also been a continuum. On one end, there's been an increase in mental illness, anxiety, depression, substance abuse, and suicide spawned from the ripple effects of the pandemic. Since the COVID-19 pandemic began, the US Census Bureau reported that adults were more than 3 times as likely to screen positive for an anxiety disorder in 2020 compared to 2019. But not having a mental illness doesn't mean you're flourishing or thriving. Just because you're not depressed doesn't mean you're joyful and motivated. In a general probability sample in the United States pre-COVID, barely 20% of people were flourishing. Just as the absence of physical illness like heart disease doesn't mean a person is at the peak of health, there's a similar spectrum in mental health. Absence of anxiety or depression doesn't mean we're at the peak of emotional health. Well-being is a continuum, and a feeling that has been pervasive, that I hear repeatedly from my patients and some of our staff, is a certain loss of energy and enthusiasm, a feeling of blah. It's different than burnout. People are still getting their work done. This silent epidemic has been termed languishing. It's a mental state that was described nearly 2 decades ago by Dr. Corey Keyes, who's an internationally renowned professor at Emory. He described languishing as having little emotional, psychological, or social well-being, yet not being clinically anxious or depressed. Languishing is insidious, and it puts us at risk of mental health and physical ailments, just as mental illness. How each of us have responded, our ratio of negative to positive sequelae, is partly due to circumstance and part a function of where we were emotionally going into the pandemic. In healthcare, we weren't in a good place before the pandemic. Nearly half of physicians were burnt out pre-COVID. A Washington Post Kaiser Family Foundation poll found that 6 in 10 healthcare workers reported pandemic stress had harmed their mental health. 3 in 10 had considered leaving healthcare, and now more than 50% said they're burnt out. Research on U.S. emergency department healthcare workers uncovered that as many as 1/5 are at risk for PTSD. The main takeaway is that we simply weren't fit physically and emotionally going into the pandemic. The pandemic has unveiled our physical and psychosocial vulnerabilities. Just as the epidemics of obesity and chronic disease increase the risk of physical complications from COVID-19, low rates of flourishing have heightened the risk for mental illness and languishing. We need to bolster our vulnerabilities and improve our fitness. So how do we do that? This is from the New England Journal article about mental health in the COVID-19 pandemic. It makes the analogy to natural disasters and reminds us that after disasters, most people are resilient and do not succumb to psychopathology. Indeed, some people find new strengths. Our goal is to build resilience so we're better prepared in the future. And to answer how we do that, we first need to take a closer look at mental well-being. So what is mental well-being and how do we develop it? This is an important question because the term well-being is used all the time, but there's little effort to actually define it. I think of well-being as a state of harmony and balance, of using our innate resources and capabilities to achieve harmony internally and with our environment. Applied to mental health, it's learning self-regulation. At a biochemical level, it's functioning in the sweet spot range where we're most effective and efficient, where we work to our full potential and we bring out the best in others. Mental well-being is broad. It can be psychological or emotional, which some people term the science of happiness. It can be spiritual, how we serve our soul, and it can be cognitive. How do we optimize brain function, focus, and productivity? As it pertains to the pandemic, I'll be primarily talking about the emotional and spiritual, which of course will improve the cognitive. At a biochemical level, early in the pandemic, the uncertainty and threat brought on by the virus sent our amygdala, which is the part of the brain that senses fear, on high alert. That activated a cascade of nervous system chemicals and hormones that make up our fight or flight response. Built into the stress response are stress recovery hormones that immediately work to downregulate the stress hormones back to baseline. This is what happens when we use our coping mechanisms to counter stress. The parasympathetic nervous system, or the rest and digest part of our nervous system, downregulates the stress response. When we respond to acute stress in this fashion, where we activate and then resolve, the acute stress gives us a survival advantage. And some of the stress recovery hormones actually function as growth factors that help us learn and grow from the stress. However, as the duration of the stress became chronic, for many, it exceeded or exhausted our compensatory mechanisms. These people were unable to downregulate the stress response. And it's this chronic type of stress, where either due to circumstance or lack of innate resources, we can't dial down the stress response, that erodes mental and physical health. So what are the determinants of mental health outcomes? Well, they include characteristics of the stressor or activators and personal resources such as mental and physical moderators that can resolve the activation cascade. Stressors vary based on the duration, the type, and the magnitude. Good stress is typically short, can be controlled or mastered, and it's moderate in magnitude. Toxic or harmful stress is prolonged or recurrent. There's no sense of control or mastery, and the magnitude is severe. Some of the moderators work top-down, using the mind to control the body. These include cognitive techniques such as reappraising and reframing a situation, emotional approaches such as realistic optimism, and behaviors such as altruism. I think we all saw this being in healthcare with the outpouring of people that were donating masks and hand sanitizers to support us. Other moderators work bottom up. They use the body to control the mind. This is the crux of interoception, and in the past couple decades, there's been tremendous interest in this approach, such as simply deep breathing to activate the vagus nerve that feeds the parasympathetic nervous portions of our brain. Not seen here are the genetic, epigenetic, and early life development factors. And collectively, these factors determine if we grow from stress and become resilient, or if we incur damage from the stress. Resilience is a term borrowed from physics, describing an object returning to its original shape after it's been stretched or squeezed, such as a rubber band. Applied to mental health, resilience at a macro level is the ability to bounce back from stress and perform flawlessly in high stress situations. At a micro level, it's the ability to moderate and buffer stress hormones in an optimal range to avoid damage and growth from stress. So essentially, being resilient keeps us here in the sweet spot. And this is a really important point. Resilience allows you to grow and develop from the experience. Some of the stress recovery hormones, such as DHEA and nerve growth factor, are growth hormones. The stress response doesn't just end when our heart stops pounding. It goes on for hours after. We lay down crumbs remembering the path. The brain releases growth factors such as DHEA and nerve growth factor, and these growth hormones allow new pathways to get built in our brain through neuroplasticity. So the next time we encounter similar stress, we're more prepared to handle it. Some researchers refer to our ratio of DHEA to cortisol as our growth index. Over time, we get inoculated to stress like a vaccine. So we can't always control the stressors we face, but we can build our resilience, which is how I think we need to navigate through the pandemic. This is data from our executive health population. The executives that we see are C-suite executives, and they typically have very high stress job demands. The figure on the left is the ratio of the stress hormone cortisol to the stress recovery hormone DHEA. And this is among 51 executives at our executive health center. And this is blood work obtained during their routine physicals pre-pandemic. And as you can see, the ratio is highly variable. So how some people who are top level executives handle stress and the effect it has on their body based on their resilience is very different. The important concept is that resilience is partly innate, but it's modifiable and learned. And so it's a potential target for intervention. The figure on the right shows the correlation of perceived stress and resilience on how we biologically age using DNA GRIM age, measuring epigenetic changes on genes associated with aging. The correlation of biologic age is stronger with resilience than with perceived stress. This hints that focusing on building resilience may be more impactful on our health and well-being than focusing on stress reduction or modification. But how do we increase resilience? Between stimulus and response, there's a space. In that space is our power to choose our response. In our response lies our growth and freedom. I think of resilience as that space to self-regulate, which lies in activation of our parasympathetic nervous system. We can be intentional about building emotional regulation by seeking activities that generate feelings of purpose, optimism, gratitude, and compassion. And I should add that that also includes self-compassion. So for our patients that gained 15 pounds during the pandemic, part of self-compassion is to not be so hard on ourselves. And I want to take it one step further, and this is a really powerful part. Simulating activities that generate these feelings can have the same effect as performing those activities. So simply thinking and immersing your thoughts in that activity generates the same response. Just feeling the emotions of staring into the eyes of your child or pet can increase your resilience. That's what we're doing when we go to our happy place. And we know this from data from prisoners of war and Holocaust survivors who emerge stronger from captivity rather than succumb to PTSD by using this power to think and immerse themselves into the activities that generated their parasympathetic nervous system response. And the implication is huge. Despite an external situation, you can find internal calm, and this is accessible to all of us. So why does building resilience matter? When we have resilience and operate in the parasympathetic state, we can think creatively, flexibly, and we're open to new ideas. We do our big picture thinking. When we're stressed, we retreat to a narrow repertoire of response, and we retreat to ourselves. When we have positive emotions and resilience, we think creatively and flexibly, and we're more altruistic, and we think more outwardly. That allows us to meaningfully contribute and be productive. It improves performance in our leadership, which then improves our mental and physical health. And that puts us on this upward spiral of well-being. When we invest in our own well-being, we bring out the best in our colleagues, our teams, and our patients. And it's really a win-win situation. So how can we take what we've been through so far during the pandemic and what we need to do to support and enhance well-being to emerge stronger? I love this quote from Dr. Atul Gawande from his book, Being Mortal. This was true before the pandemic, and it's even more true now. We've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it's larger than that. It's to enable well-being, and well-being is about the reasons one wishes to be alive. We have to be well to make our patients well. Just as after a forest fire, there's rebirth and renewal with new saplings starting to form. After any natural disaster, including COVID-19, there's the opportunity to reinvent and rebuild. While we're reconfiguring the workplace for safety, we can reconfigure it for well-being. Currently, the responsibility for well-being typically falls on the individual, and most select goals that rely on willpower. But most elements of well-being are developed from our habits, and most of our habits are performed subconsciously. That includes our stress response and our coping skills. Building well-being into work helps us default to better responses. And it takes an organization's focus beyond interventions to support individual well-being, to address well-being from a system standpoint, and develop meaningful solutions will require addressing the root cause of the lack of well-being. This Cochrane review looked at interventions to support resilience and mental health of frontline health and social care professionals during and after a disease outbreak, epidemic, or pandemic. The authors concluded that there's a lack of both quantitative and qualitative evidence from studies carried out during or after disease epidemics and pandemics that can inform the selection of interventions that are beneficial to the resilience and mental health of frontline workers. They added that alternative sources of evidence, such as from other healthcare crises and general evidence about interventions that support mental well-being, could therefore be used to inform decision-making. So extrapolating from available evidence, I want to share a practical approach with 3 simple things we and our patients can do to improve resilience. The 3 F's for flourishing are feelings, flow, and flexibility. In his book, Life is in the Transitions, Bruce Feiler says, the key to benefiting from transitions is to not turn away. Don't shield your eyes when the scary parts start. That's when the heroes are made. And one way to lean into the transitions and manage emotions is to name them. For many of us, the pandemic created a range of new emotions. And there's a large body of literature that shows labeling these emotions, which is called affect labeling, can calm the brain and reduce stress. If we can create a space to think about and express emotions rather than suppress them, we can dampen stress. One way I do this is by journaling. My journal prompt is, what am I feeling? And it helps me access my subconscious. And I don't view emotions as good or bad. I think of them as information inputs. What lessons are my emotions sharing with me? And I use that information to align my actions with my beliefs. In addition to naming your own emotions, I encourage you to start the conversation with your patients and with organizational leadership. It's important to acknowledge rather than suppress negative feelings. Have conversations that are realistic, not artificially positive. The negative can guide ways to restore a balance, fulfill a need, or help us become better. The broader the range of emotions you can express, the more you'll be effective at managing them. The next approach is creating flow. Hungarian psychologist Mihaly Csikszentmihalyi described flow state as one where a person is completely immersed in an activity when the activity is challenging but well suited to our skills. It's like an athlete performing effortlessly when he or she is in the zone. The experience of flow in both professional and leisure activities leads to increased positive affect, performance, and commitment to long-term meaningful goals. This study examined 2 coping skills, flow and mindfulness, during the COVID-19 pandemic in Wuhan, China. 5,115 people completed questionnaires, and the authors concluded that flow but not mindfulness moderated the link between quarantine length and well-being, such that people who experienced high levels of flow showed little or no association between quarantine length and poorer well-being. Having clearly defined goals can help you achieve your flow. One way of getting clarity on our goals is life crafting. But we as humans think and relate to each other in stories, and life crafting is an evidence-based way of defining your purpose. It's essentially writing your own narrative, and it's termed a, quote, wise intervention because unlike interventions such as therapy, which can take years, it's much quicker and simpler. You can do this in 15-minute writing sessions. It's a process in which people actively reflect on their present and future life, set goals for important areas of life, social, career, and leisure time, and if required, make concrete plans and undertake actions to change these areas in a way that is more congruent with their values and wishes. It involves finding out what you stand for, finding out how to make it happen, and telling someone about your plan, so publicly committing. Business executives often have coaches and a clear and deliberate development plan, but as physicians, unlike most professionals, we're often responsible for our own career success. It's helpful not only to write our own narrative, but to understand our patients' narratives, what really matters to them in understanding their health goals. And the final resilience factor you can build for yourself and help your patients build is psychological flexibility. Psychological flexibility is an ability to act in accordance with goals and values in the presence of psychological distress. A key implication is that psychological flexibility, and hence its name, is that in any situation, people need to be flexible as to the degree to which they base their actions on their internal state. People are more psychologically healthy and perform more effectively when their decision as to how to act is based on their own values and goals. For example, if a person values being an effective leader, she will take action on a difficult task in order to pursue that value, even if doing so is anxiety-provoking. In another situation, she might refrain from taking action, such as confronting a colleague, in order to pursue her goal of being an effective leader. When you're psychologically flexible, you base your behavior in any context more on your values and goals than on your level of distress. And psychological flexibility can moderate the effects of work stress on mental health outcomes and health in general, and on work outcomes such as engagement and performance. When we're psychologically inflexible, we, quote, get stuck in a narrow repertoire of behaviors and habitual responses, or we start to avoid certain situations. In a study of 485 workers in the United States, the results indicated that psychological flexibility components may be particularly important targets for prevention and intervention efforts in the midst of the COVID-19 pandemic. And in studies on healthcare workers, psychological flexibility has been associated with greater openness to the acceptance of setbacks in the hospital working environment and increased work engagement among ICU medical staff. Three core interactive components lead to developing psychological flexibility. The first is flexible openness, a willingness to have unpleasant internal experiences or feelings in the service of what matters, and distancing yourself as an observer of your thoughts. The second is flexible awareness, paying attention to your inner state rather than being on autopilot. And the third is flexible engagement, living and acting based on your values. Psychological flexibility is not unique in its emphasis on mindfulness or awareness or goal-directed behavior, but it's unique in its emphasis on goal-directed action in relation to awareness about our internal state, so they don't thwart our goals. Psychological flexibility involves meaningful action even when the presence of adversity and there's emotional pain. So putting the pieces together, the pandemic has highlighted the need to bolster our mental well-being. Efforts towards increasing resilience can potentially better prepare for future uncertainty than stress modification strategies, and they provide opportunity for growth. Entering a positive spiral of well-being benefits us, our patients, and workplace productivity, creativity, and culture. We have an opportunity to engineer well-being into the workplace. A path towards increasing resilience includes experiencing feelings, flow, and flexibility. We need to be intentional about planning for mental well-being to address the pandemic and beyond. And here are some resources. These are 2 questionnaires, the Mental Health Continuum short form, which is a spectrum from flourishing to other states of mental health, and a psychological flexibility questionnaire for the workplace that you can use for yourself or your patients. So I want to open it up to discussion and questions. If you have any feedback or want to reach out, feel free to email me. And please also let me know what you think and give me feedback on Twitter. This is my Twitter handle, #EWHC21. Thank you so much.
Dr. Bergquist, how are you this morning?
I'm wonderful. Great to join everyone.
Thank you for that. Thank you so much for that wonderful talk. As we wait for more of the questions to come in through the Q&A or through the chat feature, I think that this is such a timely talk because as we've dealt with this pandemic, both our patients and our healthcare workers have put themselves sort of on the back burner as you live in this sort of heightened space of stress and you think you're going to get through it, but here we are going into a second, or depending on how you look at it, maybe even a third surge of the pandemic. So I think that this is an appropriate talk for what we're facing now. I had one question just to start off. We're often told that we should try to achieve a work-life balance, and that clearly has gone out the window for many of us during this pandemic. How can we get back to that, since that is so important to achieving mental health wellness?
Yeah, and that's such a great question. I'm going to start by saying that so much of the emphasis has been on the individual, and I think we need to look at well-being in the context of our work and think of our solutions as not just what the individual can do, but what our work environment can do. So it's a two-way thing. I think as a result of the focus on us as individuals, we've really emphasized more, what we can do. We can meditate, we can exercise, et cetera, but we haven't addressed the systems type of solutions that I think we're going to need to navigate our way to establish this work-life balance. So I think that's the critical part. You have to look at the source of the loss of well-being to be able to get to appropriate solutions for treating the well-being. And the source is really in the broader context that we work in. So I think that's a really big part of it. I think we have to look at the contributors at a department level and then even at a site-specific level, and to look at solutions around work-life balance and improving well-being by finding the contributors really, and they're different across subspecialty and even at a site level, depending on the local leadership. So I think it's time to have this larger conversation. I think when we look at solutions that are just, you can go exercise more, you can, eat a little bit more fruits and vegetables. I think those are helpful, and I don't mean to de-emphasize the importance of it, but I don't think that that's going to be enough to reestablish the balance and help us restore our well-being.
Certainly. The next question is, could you go over flow again? Specifically, can you define flow again?
Yeah, so flow is really this balance between, feeling challenged but not stressed. So this balance between not being bored but not being overstressed. So it's kind of this kind of sweet spot between the two. So I think of it as kind of being so engaged in a concept or an idea or what you're doing that you lose track of time entirely. And that's really when you're in this flow state. So for example, if you have even it could be something like a crossword puzzle. If you are really just into it and trying to get to that solution, and then an hour goes by, you're in that flow state. If you're not challenged enough and you're bored, you're not pushing yourself to really get to the flow state and feel that sense of kind of happiness and elation and all the benefits that come from the flow state. And if you're over challenged by a task, you're out of that flow state because then the stress predominates.
This question is from Dr. Dansby. What programs are available at Emory to help in the prevention of physician burnout?
There are several initiatives. I don't think that there's a central place where we can access programs. I think there are kind of these disparate but not yet unified efforts at helping physician burnout. I think we need to head towards something that is more centralized and more cohesive, but I don't think we're there.
I was wondering actually, not just for those who are clinicians who are on the front line working during the pandemic, but also for patients and family members of those who are working, whether you ever refer them to support groups or psychotherapists to sort of talk things out well as they're dealing with their mental health wellness.
Yeah, and really at this point, that is how a lot of the care is delivered in the context of well-being. It's individualized with referrals, to counselors, to therapists. I think this is an opportunity for us within healthcare to think of how we can offer kind of more scaled efforts, so we can include different workshops and programs that are beyond the one-to-one. Even at a site specific, a group of physicians at a specific clinic can interact in ways that can improve well-being. So I think we need to do more than just the one-to-one. We don't really have the resources. There aren't enough counselors and therapists to do this one-to-one. So I think we need to think of how to do things differently, and this is the perfect opportunity.
You're absolutely right. Can you share your thoughts on a lot of after hours meetings and conferences that happen in the medical profession?
You know, we, yeah, and I'm guilty just as everyone else. I mean, we have so many demands between our clinical demands and our academic demands that most of our academic pursuits fall outside of our clinic hours. And I think that's what is leading to a lot of these after hours work. And I think it's cultural within healthcare. And I think this is something where we can look at other industries and really learn from other industries and what is the way we can function optimally. I think we really need to revisit what's asked of us. I mean, we are put in situations where the culture is to, do things in the spirit of just contributing, contributing to our organization in the spirit of promotion and being involved in committee work. And I think it's incredibly important. It's just that every task becomes an add-on, and we probably need to reevaluate what we're asking each individual to do through all these additions.
You're right. And someone once told me so wisely, before you take something on, see if there's something else you can move off your plate. And if you can't do it, then maybe it's time to offer it to someone else. We all like to do as much as we can because we love what we do. We love contributing to the organization. But even recognizing that we as individuals have a finite amount of time, amount of energy, amount of just of ourselves to go around, and just that daily reminder that maybe you can add that last thing onto your plate, and being okay with that actually as well.
Yeah, yeah, absolutely. And it's not so much that well-being is about doing less. I don't necessarily think that that is a good way to view it. I mean, I think a lot of well-being is pursuing your passion and your interest, and letting that be the guide, and you can challenge yourself. So it's not necessarily retreating and doing less. But I think when we get too many tasks, we can't really even think creatively to pursue our own goals. So it's finding that medium.
We don't have any additional questions, but this is such an important topic. I wanted just to give you the opportunity if you wanted to give us one or two take home points that we should remember as we go out to the rest of our week, just as far as mental health well being. What would you charge us with?
Yeah, I would charge each person to really look within at what self aligns, so we can align our behaviors with our beliefs. And it's actually a really hard thing to do, but I think when we really have clarity on what matters to us, it becomes really easy to know what to say yes to and what to say no to. So I think that's my first challenge to people, to think about how you write your story and what it is that in your story is what you want to get out of your life, your career, et cetera. And let that be your guiding light of the choices that you make. There are infinite opportunities, but I think we need to be more selective about what is self-healing and what has meaning to us, not to the people we report to. So I think that would probably be the most important thing.
Okay. Well, thank you very much for your wonderful talk, Dr. Bergquist.